Welcome to another nursing video. Today's focus is heart failure, a high-yield topic for the Nclex. We'll break down the essentials: types of heart failure, risk factors, pathophysiology, symptoms, nursing assessments, interventions, and patient education. Each section highlights the need-to-know information to help you pass your exam and care effectively for patients with heart failure. Let's begin with a quick overview. Heart failure is a condition where the heart can't pump enough blood to meet the body's needs. This means that blood isn't adequately circulating, leading to poor perfusion and oxygenation in tissues and organs. The condition is chronic, progressive, and one of the most common causes of hospitalization, especially among older adults. The key point to remember is that heart failure doesn't mean the heart has stopped working. Instead, it's struggling to meet the body's demands. Next, let's talk about causes and risk factors. Heart failure is often the result of other underlying health issues that strain the heart over time. Major risk factors include coronary artery disease, where blocked arteries reduce blood flow to the heart muscle; hypertension, which forces the heart to work harder; myocardial infarction, causing damage to the heart muscle; diabetes, which can damage blood vessels; valvular heart disease, which affects blood flow through the heart. Lifestyle factors like smoking, obesity, a sedentary lifestyle, and excessive alcohol intake also increase risk. For exam questions, identify patients with these risk factors as more vulnerable to developing heart failure and complications. Heart failure is also classified based on the affected side, left-sided or right-sided heart failure. Understanding the differences between these types helps you recognize the associated signs and symptoms. Left-sided heart failure occurs when the left ventricle fails, leading to blood backup in the lungs. Key symptoms include pulmonary congestion, think crackles, wheezing and dyspnea; orthopnea, difficulty breathing while lying flat; paroxysmal nocturnal dyspnea, waking up at night with shortness of breath; cough, often worse at night and may produce pink, frothy sputum in severe cases. Right-sided heart failure happens when the right ventricle fails, causing blood backup in the systemic circulation. This leads to peripheral edema, swelling in the legs, ankles, and feet; ascites, fluid buildup in the abdomen; jugular venous distension, visible bulging veins in the neck; hepatomegaly and weight gain due to fluid retention. Study tip: left-sided failure impacts the lungs, while right-sided failure affects systemic circulation. Remembering left equals lung can be a helpful mnemonic. Heart failure symptoms are related to fluid overload and poor perfusion. Common signs include fatigue and weakness due to low cardiac output, edema in extremities, which is common in right-sided failure, cyanosis or bluish skin and decreased oxygen saturation due to poor oxygenation, nocturia, which is increased urination at night because fluids shift to the kidneys while lying down; weight gain. Patients may gain weight quickly due to fluid buildup, sometimes 2 or 3 pounds in a single day. Study tip: look for patterns or changes in weight, shortness of breath, or swelling. These may indicate worsening heart failure and signal that immediate interventions are needed. To understand heart failure, let's quickly review pathophysiology. When the heart's output decreases, the body tries to compensate. Sympathetic nervous system activation increases heart rate and blood pressure, which temporarily helps but strains the heart long-term. The renin-angiotensin-aldosterone system is activated by the kidneys to retain sodium and water, boosting blood volume. While this initially improves circulation, it eventually causes fluid overload and worsens heart failure. Myocardial hypertrophy occurs when the heart muscle thickens to try to pump more effectively, but this ultimately reduces flexibility and filling capacity. Study tip: questions may focus on the consequences of these compensatory mechanisms, especially fluid overload and increased cardiac workload. Effective nursing assessment is crucial. Here are the most important steps. Monitor vital signs for increased heart rate and blood pressure. Check daily weight. Any increase over 2 or 3 pounds in a day or 5 pounds in a week is a red flag. Conduct a respiratory assessment and listen for crackles in the lungs, especially in left-sided failure. Assess peripheral edema by looking for pitting edema in the lower extremities and sacral area for bed-bound patients. Observe for jugular vein distension, as visible bulging of neck veins is an indicator of right-sided heart failure. Nursing interventions focus on managing symptoms, preventing complications, and educating patients. Here's an overview of key interventions. Medications. Familiarize yourself with common medications such as the following: diuretics, like furosemide, to reduce fluid overload. Monitor potassium levels, as some diuretics can cause hypokalemia. ACE inhibitors and ARBs to reduce blood pressure and the heart's workload. Beta blockers to slow the heart rate and improve efficiency. Digoxin to increase the strength of heart contractions in select patients. Watch for signs of digoxin toxicity, like nausea, vision changes, and fatigue. Fluid restriction. Limit fluids based on the doctor's order, typically between 1.5 to 2 liters per day. Monitor intake and output carefully. Sodium restriction. A low-sodium diet helps control fluid retention. Educate patients to avoid high-sodium foods like canned soups, processed meats, and salty snacks. Oxygen therapy. Administer oxygen as ordered to improve oxygenation in patients with low O2 saturation. Positioning. Help patients with orthopnea by positioning them in semi-Fowlers or high Fowlers to make breathing easier. Study tip. Remember the importance of daily weights and tracking fluid balance. Questions may ask you to prioritize interventions or evaluate the effectiveness of nursing actions. Educating patients is essential for preventing readmissions. Focus on these topics. Daily weights. Teach patients to weigh themselves daily at the same time and report any weight gain over 2 pounds in a day. Recognizing symptoms. Educate patients to watch for worsening shortness of breath, swelling, and rapid weight gain. Medication adherence. Emphasize the importance of taking medications as prescribed, even if they feel well. Dietary changes. Encourage a heart-healthy, low-sodium diet and moderate exercise to support overall cardiovascular health. Fluid restriction. Reinforce limits on fluids if applicable and discuss ways to manage thirst. Be aware of complications like acute decompensated heart failure, a sudden worsening that requires emergency intervention. Symptoms include severe shortness of breath, rapid weight gain, low blood pressure, and increased oxygen demand. Study tip. Prioritize based on symptoms. Address issues like shortness of breath or weight gain urgently. Understand medications. No side effects, especially electrolyte imbalances and digoxin toxicity. Daily weights are often more reliable than intake and output for tracking fluid balance. Remember that positioning in semi-Fowlers or high Fowlers can aid in breathing. That wraps up our in-depth review of heart failure. Keep these essentials in mind as you study for nursing exams. Heart failure is complex, but by understanding the key concepts, you'll be ready for both the exam and real-world nursing practice. Well, that ends this lesson. Click here for another nursing video.